If you have been researching medications for pain or sleep or mental health, chances are you've come across amitriptyline. Once a go-to treatment for depression, this older medication is still widely used today, but not always for the reason you might expect. So why is amitriptyline still prescribed so often? And yet, they are rarely chosen as a first-line treatment for depression anymore. Why is that? As a pharmacist with over 20 years experience, I will break down the 5 most common uses of amitriptyline, from chronic pain to relief of migraine in terms of prevention. And also I will uncover 4 key reasons doctors now think twice before they prescribe amitriptyline for depression. So you need to listen to this. So people come to me and said, oh, they go home with their prescription for amitriptyline and they ring me and they say, oh, hang on, I'm not suffering from depression. I mean, how many times have I heard this? Not knowing that, yes, you might have been prescribed amitriptyline, but is it really for depression or is it for something else? So whether you've been prescribed amitriptyline or you are just curious about how it works, this will quickly break down and will help you understand how helpful they can be when it is not used for depression and why it still matters in modern medicines, irrespective of what people think. So what are the common uses of amitriptyline? I think these are something you need to know. Now, amitriptyline number 1 is used for abdominal pain or discomfort. Now, when people are suffering from irritable bowel syndrome, they have issue with sort of feeling unsettled and anxious, and sometimes they are constipated, sometimes they have diarrhea, and they have tried laxatives or loperamide or things like that and it hasn't worked. Amitriptyline is a go-to medication the doctor uses most of the time to help to calm the nerves down, to calm your gastrointestinal tract down, so that those issue of rotating from diarrhea and constipation is managed. So if you're suffering with irritable bowel syndrome, the chances are your GP may have prescribed amitriptyline to help calm things down. Number 2, amitriptyline is also prescribed for what we call neuropathic pain. These are kind of nerve pain. You get it sometimes in shingles or especially, shingles is what you get, is a viral infection in adults. So the kind of pain people get in shingles, and the description is horrendous. And so it's not the kind of pain that they can take ibuprofen or paracetamol and it does it. So sometimes your GP or your prescriber will prescribe amitriptyline simply to manage the nerve or neuropathic pain, amongst other kind of pain. Number 3, it's also used in migraine prophylaxis. What is migraine prophylaxis? This is when people have headaches, and the headache is the migraine headache is non-stop. So if you're having migraine attack going on between 2 to 4 times in a week, the chances are you're having too much migraine attack. Your GP might consider prescribing you amitriptyline to manage as a prophylaxis to prevent you having migraine attack. So that could be another reason you are prescribed that. Talking of headaches, have you seen my video on uncommon cause of headache? An unusual cause of headache? Now go onto my channel, Medic Without Jargons, and search for my video on why this young lady was having headache. It had nothing to do with what they thought it was, but it's eventually you find out what the headache is all about. So watch my video on that strange cause of headache that this young lady had. So carrying on, number 4, migraine could be prescribed for chronic tension type headache. So sometimes people have headache that is non-stop. They've tried paracetamol, they've tried ibuprofen, they've tried all sorts, and that hasn't helped. And the doctor will consider, so now you don't go to your GP and say, oh, I need amitriptyline. They would have, because the truth is that not everybody can take it. It's not stable for everybody. So it's something your GP can look at, decide, will amitriptyline benefit you for that tension headache? And also, maybe you're on other medications, bearing in mind that amitriptyline can make you feel drowsy. So if you're on certain medication or certain condition, maybe amitriptyline might not be for you as well. The 5th reason why your GP may prescribe amitriptyline, which has nothing to do with depression, is an emotional liability due to multiple sclerosis. So MS is a serious medical condition. One day somebody might be well and looking great and living the best of his or her life. The following day it might be devastating. So the pain of MS and the quality of life the pain of MS can be a serious issue. It's something your specialist or your doctor can look at and decide whether amitriptyline could be an alternative, something that they can prescribe to manage your mood and as well as manage your pain. But it's not something they prescribe willy-nilly. It's something they will look at and decide it might be an option. So why, you may ask, why is amitriptyline not the first line when it comes to depression? Before I go into the why, I'm going to ask, have you subscribed? Please hit the notification button and subscribe. I'll be so grateful that you've done so. So why is amitriptyline no longer a first line choice for management of depression? Why is it that the doctor don't really consider it for depression? Now I'm going to look at four reasons why doctors will not prescribe you amitriptyline for depression anymore. Number one is that there are better options for depression. I mean, antidepressant has come a long way. There's SSRIs like sertraline or fluoxetine, there's duloxetine, venlafaxine, there's citalopram. Talking of sertraline, do you know how long you need to take your sertraline before it kicks in? Do you know what, because people say, I've taken it for a week or two, it hasn't made any difference. Do you know how long you're meant to take it for? Go and watch my video on how effective sertraline are and how long you can take it before it gets into your system and what to look out for. So that's number one, there are better options. Number two, side effects of amitriptyline are horrendous. There are better medication with less side effect for depression. You need to understand that the side effect of amitriptyline can be so disturbing and unwarranted. Side effects of amitriptyline include dry mouth or dry eyes or constipation or even drowsiness. So these are something to think about. That's why the GP might not consider it as a first line for depression. Number three, now amitriptyline has so much interactions with other common medications. So if, for example, it interacts with alcohol. So if you're taking amitriptyline, you have to be careful how much you drink or when you drink it. You have to also be careful if you're taking diazepam and also whether you should take amitriptyline. It doesn't mean you shouldn't, but you have to be very wary that combining things like diazepam or amitriptyline, those will increase your chances of being drowsy. So you can understand that your GP doesn't see that as a first line to manage your depression. Now, most importantly, number four, this is why the GP, the doctors are reluctant to prescribe you amitriptyline. In terms of overdose, amitriptyline can be highly dangerous. It can cause death in overdose. So why will they prescribe something that they know that the safety profile in overdose is problematic? So in other words, if you're struggling with, bearing in mind that those who are suffering depression sometimes, they're always struggling with suicidal tendencies. So the last thing you want is to put into their hands amitriptyline, which in overdose can be result in serious consequences. So these are the reasons why amitriptyline is no more a first-line drug in management of your depression. Thank you for watching, and don't forget to subscribe. Goodbye.